I will be talking about something which is trivial as compared to artificial intelligence or pan-European examinations, but which is extremely important, at least for me. I'm a surgeon by training. It's also something I enjoy. I love teaching surgery, and a lot of my teaching activities evolve around teaching non-technical or technical skills. So today I'll be talking a little bit about the former. So I have something to disclose. I work for the Krakow Center of Competence Development, and I basically preach the same stuff I'm going to preach here. So let's go on. So why do we even bother? There is a lot of discussion about EPAs, about competency-based education, and somehow we are forgetting about the tiny bits which are not so, let's call it, not so sexy. But they are the building blocks. And if we don't get the small bits correctly, it's very difficult to get the whole picture correctly. Thinking about competencies, be it at entrustment level or just competency-based education in its general form, at one step or the other, you must kind of go back to basics of learning. And one of the most effective ways of learning it's incremental. You build up on the previous experience, on things which happened before. There is also one more thing. Procedure-related risk is one of the greatest risks for patients in our hospitals. It's also our big concern as teachers, because we want to make sure that our patients are safe with our trainees. Last but not least, absolutely, it's something which is very important for me, is that performing procedure is a huge emotional burden for our trainees. They don't want to harm anyone, and they want to be sure that they know how to do those procedures before they actually step up and do them on their own, be it as students or as junior physicians. So, since I hopefully justified why am I standing here and why we have chosen the topic, let's think about the building blocks of those procedural skills. Knowledge is quite obvious. One must know, when to use the skill, what are the indications or contraindications, what are the small steps in the procedures. Of course, there is this technical ability, and this is what I will be talking mostly about during the remnant of the presentation. But there is also something very important, which is all those cognitive skills, like the awareness, the decisiveness, the courage to do. I'm training surgeons. A surgeon without courage is dangerous. It's like monkey with a gun. Random use of the skill is very dangerous. A surgeon must be trained to courageously act upon his skills. But it's so difficult when we get graduates from schools which have been for years taught you're not good enough, you can't do it. It's very difficult to build that up. So that's also one very important aspect of what I'm going to talk about. So what's important in teaching those procedural skills? First of all, it's very clear demonstration. I mean, people must know what they are supposed to copy, because this is how we teach. And this is a skill, we show the skill, and that demonstration must be proper. Then a repetition and practice is important. And I will be discussing all those mentioned topics briefly later on. Obviously, evaluation and feedback, but I think I will have some news for you here. Active learning and cognitive engagement. We don't want to bore anyone to death doing stuff. They must remain engaged in learning, otherwise they may learn otherwise, or something different than we intend to. And of course, they must be motivated, but one thing which is absolutely crucial to all of that is that we must have a design of the whole curriculum which supports learning of skills. It must not be random. It must have a general idea behind it, and there is some science about that. So what do I mean by clear demonstration? How do we frequently do it? You get a teacher who starts explaining stuff and showing things while he's doing this. Don't get me wrong, if you do it that way, just stop it. What does it mean to have a clear demonstration? Do it as you do it. Make it the best performance you can, not the fastest, but a good one. Because student must develop a benchmark, something he is aspiring to achieve. Not your performance when you keep blubbing left and right about things and explaining all the difficulties of the procedure. Just do it. Let him or her see what's the benchmark, what they should aspire to. It's especially important for training residents. Now, the next thing is that then you should demonstrate this and explain what's happening, why you do things, so that they can learn to understand. Repetition and practice. Well, this is something crucial, obviously. For close to 3,000 years, we know that repetition is the way of learning. But how much students should repeat or a learner should repeat? All that we don't know, because that depends on so many variables that it's very difficult to predict. This is when the art comes into science, and you must just watch your students and see how good they are, how skilled they are. The good news is that very few of medical procedures need some enormous manual skills. For vast majority of them, everyone can learn. Now, the next important thing is the complexity of the task. Why I think that it's important? Because that's the only thing we control. We get students or trainees with skills, abilities, which are as they are. We can't influence that at that moment. We must work with what's given, but we can influence the complexity of the task. So we need to make the task as simple as possible and at the level of learner's abilities. Now, learning curve for most of the procedural skills has diminishing returns. What does it mean? You repeat it 5 times, you learn a lot. You repeat it 5 more, you do not learn twice more. You earn another 20%. You repeat it 20 times more and you get another 2%. What you can do is let the people start forgetting and then teach them again. So you need that drop in performance before you actually start teaching people again. Why? Well, because they kind of learn it anew. We do not fully understand the cognition behind it, why it does work, but we have a lot of evidence that this is how it works best. It's also best for retention, and here we have some news. It's probably best for retention because if something happens frequently to us, it must be important. So let people rest from your teaching at some point. Evaluation in feedback is good, we know it. Does everyone agree? That's good. But have to be timed. There is this saying in Poland that the guest which doesn't come in a proper time is worse than an invader, and it's the same about feedback. If feedback is not timed properly, if it's too late or too early, it harms the performance. One thing which is very important is that feedback needs to be structured properly. So we need to teach people how to give feedback so that it is effective, that it gives what it needs to give, nothing more, nothing less, and it's properly timed. We know it from science that if it's too often, there was some research done on continuous feedback, but it didn't work. It actually decreased the learning and decreased the performance. So feedback needs to be timed properly, frequent enough but not too frequent, and aligned with current learners' needs. There is zero sense in teaching something which a student or learner cannot comprehend at the moment. Well, we think it's most likely due to its effect on focus or attention. So if you provide continuous feedback or non-timed feedback to people who are not ready to get it at this moment, it creates gaps in attention. They stop paying attention to a learning task and pay attention to your feedback. And the second the second reason is that it creates a dissonance. If you are not ready to receive the feedback and you still get it, what you learn? Why it's not your fault that this is what you did. And it's not our goal. Active learning and cognitive engagement. It's usually quite easy. I teach procedural skills and students like it. Residents like it. This is why they came to become surgeons. I mean, they want to learn how to perform. But we must be aware that disengagement and boredom are the enemies of learning. People must have an engaged mind to learn. There are very, very few skills to which we need to have students, or it's more like residents, perform subconsciously. Those you sometimes need to train to the level of boredom. They must become automatic, but it's very, very few in medicine. Usually we really need people learning and performing to be mindful of what they are doing. The key is the reflective practice. Once I've learned a very valuable lesson from a sport coach. He told me the story of famous sportmen like Michael Jordan, like Tiger Woods. He asked me, do you know what is the difference between Tiger Woods and Michael Jordan and 25 million of other talented Black American people who did not achieve what those two achieved? I said, well, they practiced more. No, they didn't. They practiced differently. Michael Jordan didn't go to the gym and didn't shoot 1,000 shots to get better. Tiger Woods didn't strike 1,000 balls, golf balls, and just be happy with it. They would go, do 10 or 20 or 50, see what's wrong, correct it, and shoot another 50. If you shoot 1,000 balls wrongly, what you learn? How to be really good at making mistakes. Without reflection, practice is meaningless. I would also encourage everyone to consider, for the sake of reflection, that debriefing the procedures might be better than giving feedback. If you give feedback, you tell person what was done correctly, what was done in a way that should be improved. Maybe it's better to ask them. And then reflection happens, and miracles to happen too. Well, students, residents, they like learning skills. Oh, we have some young faces here around, and I see them nodding. Thank you. It's very encouraging when you are here and someone is responding to your lecture. But they don't like if they can't use what they learn. We teach them stuff, and then it's very difficult for them to perform it in real life in a hospital. This is why I like an idea of EPA so much. I spent a lot of time teaching someone a procedural skill, and then I know they are very good, and they ask me, well, Dr. Mike, can I do it? And the answer is no. It ruins the whole experience. It shouldn't happen like that. EPAs are the way to go. And now something really important, the design of the whole curriculum. First of all, we must start with simple. I've seen a screensaver here. We must start with simple things. We must always plan on adding on previous content. This is how human beings learn. We must strive to provide connections. Like, make sure that what you teach is relevant to what is being taught in different places. Also for procedures. They are not disconnected from other parts of education students to have. You must plan on the whole path, like what they will do with what you teach them today. Will they need it next week, next month to learn something more? For example, you start with explanations in a lecture room, then you have a closed group discussion, then you take those skills to a skill lab, and then you bring it to high fidelity simulation, but then it must be brought to a hospital. Repetition must be planned. It's important for knowledge, but it's even more important for manual skills. And there is one thing which I would like to have you ponder about. There is this famous saying that you can see one, do one, and then teach one. And it's often used to describe something which is very simple. Oh, it's so simple, you can see one, and then you can do and teach. For me, it's the ultimate understanding of how to teach procedural skill. Have a look at one, then get trained, and then to really understand it, teach it to the others. Nothing did so much good for my basic skills in manuals, in basic surgery or laparoscopy as teaching residents and students, because I had to go to my basics, had to make sure that I do everything correctly. And we utilize that also for teaching. Like, have senior students teach juniors, help you, help themselves, everyone gets a benefit. So to summarize, how do we do it? Well, first of all, choose a useful procedural skill. Not something you like, but what is being either dictated by regulation or commonly accepted as a useful skill. I've seen hundreds of programs teaching or having a requirement to acquire a skill which is no longer performed. That should never happen. Then you break it into small individual skills. You identify the tiniest building blocks of what is to be done. It's important then to start planning, but you plan it backwards. You think when they will need it. And then you move backwards from that spot and you find the beginning moment. And this is how you start, because then the path has an end, which is meaningful. Demonstrate the skill, first in the real life, and then demonstration with explanation. Then let people practice. Don't overwhelm with feedback, but provide sufficient. Provided it's directed, it's structured, and it's timely. And then create a space for them to reflect on how they did, what can be done better, provide help and support, but don't give answers. I was asked by the organizers to provide 2 take-home messages. So I would say that the most important things is planning backwards and creating a space for reflection. If you do this, they will be motivated, they will know why they learned it, and they will deliberately think about how to get better, because they know they need it sometime soon in the future. And last but not least, have fun teaching. There is nothing more boring than a boring teacher, and there is nothing more fun than the fun with someone who enjoys doing this. Thanks a lot.